Do you know what social elements of healthcare are facing your community, or the difference between equality and equity as it pertains to your health? We'll explain. Meet a student who's helping our Native American population in the Four Corners region beat food insecurities. See how planting seeds can make a difference. Plus, it's cold and flu season. How are you dealing with it? Dr. Scott Cyrus is stopping by to help us get through this together. It's the holiday season and our student organizations are busy with their community initiatives. We have a special treat as student doctors bring music to our ears. All that and more, so let's get started. Hey everybody, welcome to another episode of the D.O.Pulse, a podcast about osteopathic medicine, education, and community. I'm your host, Sidney Alvarez. This show is brought to you by Burrell College of Osteopathic Medicine, and we have an amazing lineup for you today. In fact, joining me now is, I'm super honored to be here with Dr. Mary Lacaze, and you have a really amazing title. I just want to make sure I get this right, okay? Associate Dean for the Office of Community-Based Learning and Social Accountability, Associate Professor in the Department of Preclinical Medicine, and Co-Course Director, Mission Medicine, Pediatric, Hematology, and Oncology. Did I get that right? I tried. Maybe there's more. I tried. But thank you for being on the show.
Absolutely. My pleasure.
Thank you. And we're here to talk about community-based learning and addressing social accountability in health. For us, we call it mission medicine. Tell us about mission medicine. What is mission medicine?
Well, Mission Medicine is a new curriculum that we are putting together that has really stemmed from our president, John Hummer, and Dean Bill Peratt. And it's really, the way I say it best is really making our mission go live, putting our mission out there to the community.
Saying what we're supposed to do.
Yeah.
Right? Yeah.
Right. So Mission Medicine is kind of a broad term that we're using to kind of incorporate this part of the curriculum. It is partly didactic. This is mandatory for all students, and we have about a 90-minute, once-a-week didactic session. And this is almost a potpourri of a lot of different themes and topics that are really important to just being a physician today. Certainly there are things like epidemiology, biostats that we teach in this course. That's part of board preparation. We go into biomedical ethics. We talk about palliative care, cultural humility, equity and equality. We focus a lot on health disparities stemming from the social determinants of health. So really it's a curriculum that is really designed to help foster our future physicians to be advocates, healthcare advocates to the community to which they serve. And what better way to do that but to really, have boots on the ground and be involved in our community.
It makes me feel like we're making our mission actionable.
Absolutely.
And we are having our students physically in the community, helping and learning. Tell me about this.
Yes, we are collaborating with various stakeholders of various community organizations with certain missions that are accepting our students in their individual venue to have that exposure and experience working with certain various different types of individuals and populations and understanding the health disparities and understanding the social determinants and how they really contribute to health disparities.
Let's take a look at a story that we have from Florida about how Burrell College of Osteopathic Medicine is partnering with a local health organization. Let's watch this.
Health First is Central Florida's only integrated delivery network. When you look across the spectrum of services that we provide, it would take me a very long time to describe them all.
They provide about 60 to 70% of the care for the residents in this community. Having them partner with Burrell College is a fundamental piece to our development and our growth. They will provide service and care delivery and teaching for all of our students as they go through the system.
So as populated as Florida is, it is not equipped with enough physicians to take care of its growing population. So our goal is to educate and train those future physicians right here in Brevard County to be able to meet that need.
We love our partnership with Burrell. They seem laser focused on training the next generation of good providers. People are moving here, companies are coming here, and as the population grows, the needs increase to serve that aging population. And so, we're acutely aware of that. And through our partnership with Burrell, we think we're going to be able to bring new resources to bear to serve the community.
So you wouldn't necessarily think of Florida as being in need for, or being considered a rural area and having a need for mission medicine, but that's not the case.
No, I don't think there's a state within the United States that doesn't have a need for this type of exposure and experience. Every community, or there's various communities within a given state that are more rural or are underserved. And, schools that really highlight and reflect on their mission statement and make it live. It's really been shown that more medical students then do actually enter the field of primary care, and often in underserved areas.
So let's talk about social determinants of health. What do we mean by this?
Well, when we refer to the social determinants of health, we really are looking at economic stability, education,
so many different variables, right?
And the environment one grows up. Are there parks in the community? Is it safe to go walk after dinner? Certainly health care, one of the social determinants, access to health care, and community engagement, community involvement, community support.
Let's watch a story of one of our students and her involvement with the Navajo Nation. Watch this.
Hi, I'm Lacaze. I'm a fourth-year student doctor at the Burrell College of Osteopathic Medicine. I think it's very important to advocate for mission medicine as student doctors because many of our patients in the area face barriers to their health care, including access to nutrient-dense foods. So during my fourth year, I really wanted to gain hands-on experience in advocacy for my patients in this way. I had the opportunity to rotate in the IHS, the Indian Health Service facilities, in Shiprock, New Mexico, in Chinle in Arizona, and Fort Defiance, also in Arizona. On my rotation in the Four Corners, I was fortunate enough to spend a lot of time on the Navajo Reservation in some of the Indian Health Services hospitals. A recurring theme was difficulty for my patients accessing nutrient-dense foods and kind of taking care of their metabolic health. On Earth Day, I got to go out and help them plant seeds for their first planting of the season. So we planted corn and some other traditional grains, and it was just a really exciting way to get outside and get involved with the community for me. I want to become a doctor because I think being an advocate for your community is really important. I also think there's a huge need in the Southwest where I grew up for doctors, and I'm hoping to help bridge the gap.
Just amazing work that Lacaze is doing. What a wonderful story.
Oh, absolutely. Boots on the ground,
Absolutely.
Really getting immersed in the community. And that's how you know that, you can really be able to give everything to the patient that you're taking care of. Because today, the whole medical system is so complex, but you also need to know what organization and support systems are out there to refer patients to.
Dr. Lacaze, they're telling me that we're running close on time. What's the takeaway? You go ahead and look at that camera and you tell us, what's the takeaway when it comes to mission medicine?
That Burrell College of Osteopathic Medicine firmly believes that medical students, future physicians, need to become healthcare advocates to the community they serve to impact communities, counties, regions, the state, to further advance our healthcare system for equity for all.
Absolutely. Thank you so much for your time. I know that we could devote more time to this, and I really want to do this and invite you back again. It was very informative. And for more information, people can go to burrell.edu, and we'll be right back after this break. It's the holidays and our student organizations are busy with their community initiatives. We have a special treat as student doctors bring music to our ears. That's next after the break. Plus, it's cold and flu season. How are you dealing with it? Dr. Scott Cyrus is stopping by to tell us how to get through this together. That's next after the break.
Your time is now, right here at the Burrell College of Osteopathic Medicine. We have a 99% graduate residency placement and more than 850 physician preceptors, plus a simulation department, gross anatomy, and research labs. We offer Mission Medicine, a community-based learning experience with 2 campus locations, New Mexico and Florida. Go to burrell.edu and apply today. And remember, your time is now.
Hey everybody, welcome back. It is cold and flu season. We're smack in the middle of it, it feels like. And to help us get through this, I am joined by somebody who's super awesome and informative. We are joined by Dr. Scott Cyrus, D.O. I want to make sure I get this correct. Chair of Clinical Medicine, Professor of Clinical Medicine, Clerkship Director, Pediatrics. Wow. Okay.
Lots of hats.
Yeah, lots of hats. And for sure, because I mean, we're looking at COVID, RSV, flu, even allergies. I mean, so what's going on? How do we protect ourselves?
Well, obviously staying away from the germs is the best thing, of course, but with the cold and with it all being, everybody kind of driven in for the holidays, all of a sudden we're around one another. So if you're obviously running fever or having runny nose, cough, wheezing, things like that, you definitely need to be staying away and keep your germs to yourself, as we like to say. Cover your cough, cover your sneeze. Wash your hands frequently. This is just some of the common sense things that we really recommend that people can do at home.
You know, so my challenge is, how do you know what is what? Right? What is the difference between the flu? What is the difference between, allergies or a cold, and now you throw in RSV and then you throw in COVID? What's the difference?
It just makes your head spin sometimes trying to figure it out, even as a physician, because as kids come in, they may have a cough and a runny nose. Well, but do they have fever? If it's a fever, it's really high, like 103, 104, you're more likely to have the flu. Whereas COVID, thank goodness, hasn't really affected our children too badly. It is still affecting our children. They runny nose, cough. Sometimes they'll have a low-grade fever. The first season when COVID first came out, the youngest patient I had was 2 months of age, had no symptoms. No symptoms whatsoever. Great-grandmother was taking care of the child who had symptoms, and so they just tested the child, and sure enough. So it's hard to tell. Bottom line, it is hard to tell. Usually the high fevers with children is flu, could be pneumonia, can be sometimes even strep throat, and we're still seeing even strep throat. Allergies are typically a cough and a runny nose, and we can take care of that with some of the over-the-counter medications.
So are we seeing an increase in all? It feels like it's the trifecta. It's beyond the trifecta.
Yes, it is beyond the trifecta.
Are we seeing an increase in this?
Yes, by far we're seeing it. Right now we're in the middle of the season, so it's of course recommended to get your flu shot, get a COVID immunization, and also with RSV, we can now immunize our children, young children, and our older adults with an RSV. They call it a vaccine, but it's really just a monoclonal antibody, but it helps keep the RSV away from us.
So how do we protect ourselves? I know that with the past couple of years, it's been ingrained. Wash your hands, wash your hands. But what if you're around somebody, and they're coughing, or you're caring for somebody? How do we protect ourselves?
Well, mask or proper use of mask. Of course, everybody that likes to wear the mask down across where their nose is exposed is not wearing it properly. But vaccinate. That's one of the best things you can do. 6 months and older for infants, and older adults for RSV. Vaccinate against RSV. Vaccinate against with flu, and also vaccinate against COVID. That's our best chance of not contracting these diseases, because the germs are everywhere, and it's just almost impossible to stay away from the germs.
So if we do have these symptoms, or we're ill, How do we know when it's time to seek help? When is it time to go to the doctor?
Great question, and that is, if you're having trouble breathing, if your cough is keeping you up at night, the babies can't eat because they're coughing or breathing so fast. Definitely need to be seeking the doctor's help at that point. If it's after hours, take them to the emergency room. Obviously, if you're worried about your child, check in with your doctor and make sure that they're healthy, or it is maybe a simple cold. But in this season, and with all the illnesses that are out there with COVID, flu, RSV, it is really important that you seek help and seek it early.
So, there are lots of over-the-counter medications and remedies. Is there anything that you recommend maybe that we should maybe keep in stock?
Well, Tylenol and ibuprofen, acetaminophen, ibuprofen, always things to have around the house, either in liquid form if you have little children or in pill form. Chewables also that you can have. Sometimes over-the-counter antihistamine, daily antihistamines, the non-sedating ones like people know Claritin, they know Zyrtec, some of those that are good, because if, let's say you have a child who starts with a runny nose, would a dose of antihistamine hurt them? Not at all. It's a great thing to try to see if that doesn't slow the symptoms down. But cough medicines, we don't use a lot of cough medicines. We use honey, believe it or not. It coats the throat. It actually calms the cough. And so, but if those things are not working, definitely need to see your physician.
Can you over-medicate on over-the-counter?
Oh, by far, yes.
Okay.
So you really need to follow the instructions. Call your doctor's office. I know I have people call my office many times and say, hey, what is the dose for this or that? And we are more than happy, because in pediatrics, it's weight-based. So we are more than happy. You don't use honey in children under 1 year of age. So they have to be at least 1 to go forward. So we have to look at why are they coughing? Is it wheezing? Is it, what's the cause of it to treat for children?
So, Dr. Cyrus, I want to talk a little bit about you and your relationship with Burrell. You're an instructor here at Burrell, had this really great title for you and rattled off a whole lot of information at the beginning of the show. But tell us about what you do here at Burrell.
Well, I am the clinical chair for clinical medicine. I am the professor of pediatrics. This is one of the best jobs I've ever had. I own my own pediatric practice, and so I get to practice and I get to teach. I get to teach all these wonderful students. It's amazing. That's one of the things that really drove me towards Burrell, is that ability to be able to connect the dots for the students and do that early on. So as they go out on the rotations, they can understand what's going on the inside and what are they seeing on the outside.
How do you, we're talking about, flu, COVID, RSV. How do you take what you're teaching and share your experience with our students, especially when it comes to something like this?
Well, the basic science faculty here are really good about giving them this knowledge, this base knowledge, and taking that base knowledge and elevating it to that clinical knowledge is extremely important. And like I said, trying to connect those dots, letting them understand what's going on inside. Why is wheezing such a huge part of RSV? Because if you understand that it affects the inside of our lungs, it narrows our airway, then they understand why the treatments are the way they are. Should we be giving them breathing treatments? Should the patient be getting steroids? And then understanding from a clinical standpoint when they should be hospitalized, when they need oxygen, and things along those lines.
Let's talk about your DO. And I want to know why you decided to pursue osteopathic medicine.
Osteopathic medicine fit me, and I fit osteopathic medicine. The thinking of preventative care, the thinking of we're all one body, the way we feel about ourselves, the way we think about ourselves, the way our heart rate is, and the anxiety we may have on a situation, all of that plays into overall health. What does it do to my blood pressure? What does it do to my heart rate? What does it make me feel like? Do I want to even get out of bed sometimes? To me, osteopathic medicine answers all those questions. And so I share these things with my patients and say, yeah, I understand, I can relate to what you're saying, but look at it from this point of view to see if it doesn't motivate you to have better health, preventative care, things along those lines.
Dr. Cyrus, when people watch this show or listen to this show, I always want them to have a takeaway. Okay, so we're talking about, a lot of information when it comes to COVID, RSV, flu. What's the takeaway? I want you to look at that camera and I want you to tell people, look, this is what you need to walk away with. What is that?
What you really want to walk away with is taking care of yourself. Make sure that you're doing everything in your possibility that you can do to make yourself healthy. Vaccinate, wash your hands, cover your cough. People are sick, wear a mask. Don't be afraid to wear a mask on airplanes, in crowded areas. Make sure you take care of yourself and know that we as physicians, we as osteopathic physicians are here to help you when things go awry.
Absolutely. Thank you so much. And for more information, you can always go to burrell.edu. And Dr. Cyrus, thank you so much. I sincerely appreciate all your help.
No problem. Thank you very much for having me.
Absolutely. And we'll be right back. It's the holidays and our student organizations are busy with their community initiatives. We have a special treat as student doctors bring music to our ears. That's next after the break.
Your time is now, right here at the Burrell College of Osteopathic Medicine. We have a 99% graduate residency placement and more than 850 physician preceptors, plus a simulation department, gross anatomy, and research labs. We offer mission medicine, a community-based learning experience. We have 2 campus locations, New Mexico and Florida. Go to burrell.edu and apply today. And remember, your time is now.
Hey everybody, welcome back. I'm super excited because as you can see, we have a very festive group here joining us. Burrell College of Osteopathic Medicine offers a variety of student clubs and organizations. They are very active and offer speakers, service projects, and outreach while helping students learn important lessons in a non-academic setting. Here to tell us more is first-year student doctor May Sloan. May, it's so great to have you here.
I'm happy to be here.
Yeah, and quick introductions. Tell me who's here.
So this is the Vice President here, Rila.
Hi.
And this is Seychelle. This is Riley.
Hi.
This is Melody. And this is our treasurer, Isaac.
And your student org is what?
Music and medicine.
Tell me about music and medicine.
So we're just a group of students and staff and faculty can join if they want. And what we do is we just share the love of music, and that is through singing or playing instruments.
So, you all have been performing in various areas around town. Tell me about this.
So lately we've been going to nursing homes, and we book about an hour, and what we do is we sing songs, and we may do a little jokes here and there, but yeah, we have fun.
You started this, correct?
Yes.
Why did you want to start this?
Because I have a love for music. Music has changed my life. It made me who I am today, and I know I would not be the best doctor that I could be without, having that part with me. And I know that that is also not just for me, but also for my fellow colleagues as well.
And I know that you guys are in a field of helping people, and music is also therapeutic. Tell me about that.
So music has a way of healing spiritually, emotionally, or mentally, and that can also transcend into physical healing, and that is very important, especially whenever we go into the nursing homes. So yeah.
So y'all, we have a very special treat for you. They have agreed to sing 2 songs for us. What are they?
They're Silent Night and Carol of the Bells.
So we're going to play out the show with some entertainment just for you. So thank you guys for doing this.
You're welcome. You ready? All right.
Silent night, holy night, all is calm and all is bright. Round young virgins, mother and child, holy infant, so tender and mild. Heavenly holy face, with the dawn of redeeming grace. Jesus, Lord, Lord of thy birth. Jesus, Lord of thy birth, in heavenly peace. Rest your head upon your mother. You're irreplaceable, there's no other. You came to earth 'cause you were willing. You see the Bible is fulfilling. Rest your head upon your mother. You're irreplaceable, there's no other. You came to earth 'cause you were willing. You see the Bible is fulfilling. Sleep in heavenly peace. In heavenly peace. Hark how the bells, sweet silver bells, all seem to say, throw cares away. Christmas is here, bringing good cheer to young and old, meek and the bold. Ding dong, that is the song with joyful ring, all caroling. One seems to hear words of good cheer from everywhere, filling the air. Oh, happy pal, raising their sound. Oh, hill and dale, telling their town. Merry, merry, while people sing songs of good cheer. Christmas is here. Merry, 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 merry Christmas. Merry, 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 merry Christmas. On they sing, on they ring their joyful tone to every home. Riggy diggy ding, ding, ding ding dong ding, riggy diggy ding, ding. Ding ding dong ding, riggy diggy ding dong ding dong ding dong ding dong ding, riggy diggy ding dong ding dong ding dong ding dong ding, riggy diggy ding dong ding dong ding dong dong ding, riggy diggy ding dong ding dong ding dong ding, riggy diggy ding dong ding ding dong ding, riggy diggy ding dong ding dong ding, riggy diggy ding 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 dong ding. Ding